Market an IOP or PHP in Missouri under the wrong category, and you build in certification, contracting, and documentation risk. 5 possible paths, and Missouri does not reduce the decision to simply adding more groups. Your Missouri group practice already has clinicians, referral sources, intake habits, and a reputation. The question is whether those assets support a higher acuity, group-based, payer-facing program. We will walk through the 4 questions to resolve before you market the program: certification, staffing, location, and payer strategy. Before anything else, name the model you are actually building. Is this ordinary professional outpatient care, a DBH-certified substance use treatment program, or a CSTAR path? A MO HealthNet strategy, or a commercial payer program that still needs facility-style operations? That answer affects location, staffing, credentialing, documentation, billing, and launch timing. Missouri has broad treatment demand across St. Louis, Kansas City, Springfield, and Columbia. But marketing an IOP or PHP before the program category is settled creates real risk. Convert on the wrong assumptions, and you create certification, contracting, and documentation risk for a practice that was healthy. A practice that already bills professional outpatient therapy may still need new enrollment, authorization, documentation, and revenue cycle workflows for IOP and PHP care. When admissions, treatment planning, attendance, authorizations, billing, outcomes, and reporting all need to move together, basic scheduling and individual notes start to struggle. A treatment-focused EHR, CRM, and RCM workflow is designed to reduce that friction as the program becomes more structured than ordinary outpatient therapy. Behave Health brings the EHR, RCM, CRM, credentialing, and workflow infrastructure to make a conversion work in practice. 4 questions to resolve before you advertise, contract, or bill under an IOP or PHP model. Let us take them in order. Step 1. Certification. Missouri DBH's certification page says certification is not required for non-contracted agencies providing mental health or substance use services, unless another rule or funding source requires it. But any organization contracting with DBH must obtain and maintain certification, and certification is tied to eligibility for programs like C-STAR. Start with DBH's certification page, the 9 CSR 30-3 program rules, and the MO HealthNet C-STAR manual. Then verify the exact category with DBH, counsel, and payers. Step 2. Staffing and clinical leadership. Strong therapists do not automatically create the structure for organized IOP or PHP care. More intensive programming adds clinical governance, group coordination, utilization review discipline, and documentation consistency. Ask where the model is thin, who owns admissions, verifies level of care, monitors documentation, and handles authorizations and denials. Step 3. The location. A space designed for individual therapy may not support structured treatment programming. Evaluate privacy, group rooms, accessibility, waiting areas, records workflows, parking, and signage before you commit. If CSTAR or a DBH certified model is part of the plan, review site readiness in that context before spending money on build-out. Step 4. Payer strategy. Run it alongside the certification analysis. A self-pay or commercial-only program has a different risk profile from a DBH contracted or MO HealthNet C-STAR strategy. Before relying on the revenue model, verify enrollment, credentialing, medical necessity criteria, documentation expectations, and authorization review with each payer. Missouri DBH describes C-STAR as a full continuum substance use disorder treatment model. The MO HealthNet C-STAR manual is the official Medicaid starting point. Treat search phrases like Missouri IOP licensing requirements as discovery terms. They may not match the state's exact categories. Use Missouri DBH, MO HealthNet, payers, and qualified counsel for the authority-specific decisions. Bring Behave Health in for the EHR, RCM, CRM, credentialing, and workflow infrastructure that makes the conversion work in practice. Stop building certification and contracting risk into your Missouri expansion. See the EHR, CRM, and RCM workflow built for structured programs. Book a 20-minute demo at behavehealth.com. Talk with Behave Health before you market the service or commit capital. Book a demo at behavehealth.com.